Hi, we are from Group 10 and we will going to talk about awareness of dementia among geriatric. So, what is dementia?
Dementia is the loss of cognitive functioning, which are thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with a person's daily life and activities. Dementia is caused by the loss or damage of nerve cell and their connection in the brain, which can be caused by depression, medication side effect, excess use of alcohol, thyroid problem, or vitamin deficiencies. The sign and symptom for dementia depends on each person, but most common sign and symptom are difficulty in concentrating, hard to carry out familiar daily tasks such as getting confused over correct changes when shopping, struggling to follow a conversation, being confused about the time and place, mood changes, and memory loss. The risk factor can be classified into two types, which are cannot be changed and can be changed. The risk factor that cannot be changed are age for individual who is 65 years old but can also occur to young people. Next is family history and Down syndrome. For the risk factor that can be changed are diet, excessive alcohol use, smoking, and depression.
What is the differences between Alzheimer and dementia? The differences between Alzheimer and dementia are the age of onset. Alzheimer's disease typically has an onset later in life, with symptoms appearing after age 60, while other types of dementia may have an earlier onset. After that is the progression of symptoms. Alzheimer's disease tends to progress gradually over several years, while other types of dementia may progress more rapidly. Lastly is the pattern of memory loss. In Alzheimer's disease, memory loss tends to be more pronounced for recent events, while older memories may be preserved for a longer period. While in other types of dementia, memory loss may be more evenly distributed across time periods.
This is the example on how to reduce the risk of getting dementia, such as regular physical activities, eating healthy diet, stay socially active, avoid tobacco, alcohol, and drugs. The other ways to reduce the risk of getting dementia are learn new things, keep mentally stimulating activity in daily routines, having regular medical checkup, and managing chronic medical conditions.
How dementia affects the persons and surrounding. The first one is executive functioning. Dementia affects a person's executive functioning, making it challenging for them to complete simple tasks and the steps that go into them. Second is memory. Memory loss is one of the most renowned symptoms of dementia, with both long-term and short-term issues across the board. During the early stages, you may forget where you grew up or how to make a cup of tea and sometimes how to perform ADL tasks. Older people living with dementia often battle memory problems when carrying out the simplest tasks such as wearing clothes. The third one is judgment and attention. Due to the lack of signals being sent around the brain, judgment, attention, and decision making are notably affected. This lack of judgment and attention can also be quite dangerous for the person in question and others around them. For example, they might leave the oven on or forget to blow a candle out. The fourth one is behavioral and physiological symptoms. Many family members find that the behavior of their loved one has changed in the later stages of dementia. In some instances, they find their loved one resists any help or assistance with day-to-day activities, further complicating things. The fifth is impact on confidence and self-esteem. Dementia may cause people to feel insecure and lose confidence in themselves, and their abilities. They may feel they are no longer in control and may not trust their own judgment. They may also experience the effects of stigma and social demotion, not being treated the same way by people as a result of their diagnosis. The last one is emotional effects. People with dementia often experience changes in their emotional responses. They may have less control over their feelings and how to express them. For example, someone may overreact to things, have rapid mood changes, or feel irritable. They may also appear unusually distant or uninterested in things.
The ways to communicate with a person with dementia are require calm and clear communication, use short and uncomplicated language, prefer short and regular chat if the person is easily excited, and avoid using harsh words. Other than that, be patient and respectful where don't treat the person with dementia like a child is also one of the way to communicate with them. Try to connect with the person in a conversational manner rather than bombarding them with a question, which can be exhausting or scary for them. After that, always involve the individual in discussion with others and not treating them as if they are not present. Being included might help them maintain their sense of self and recognize their worth. It may also assist them in feeling less ostracized or isolated. And lastly, do not raise your voice to them. So, why people with dementia show signs of distress? There are different causes of distress behavior which include the fear of embarrassment, frustration with a situation, depression because there are no other way to express themselves, loss of judgment, loss of inhibition and self-control, and the fact that sometimes they might be in pain but cannot communicate effectively. For the conclusion, firstly, dementia is not a specific disease, but rather a general term for the impaired ability to recall, think, or make choices that interferes with daily activities. Secondly, dementia is not a normal part of aging because many elderly people spend their life without developing dementia. Thirdly, a person with dementia can be identified with high degree of accuracy by doctors. However, determining the precise of dementia is more difficult because the symptoms and brain changes of various dementia can overlap. Fourthly, the same drugs used to treat Alzheimer are sometimes prescribed to assist with the symptoms of other types of dementias. Last but not least, according to research presented at the Alzheimer Association International Conference, making a number of healthy lifestyle choices such as eating a healthy diet, not smoking, exercising regularly, and engaging in cognitive stimulation may lower the risk of dementia and cognitive decline.